The country has since March 1, 2021, administered over 1.2 million doses of vaccines, according to data from the Ghana Health Service. As of 20th August 2021, Ghana had, however, taken delivery of a total of 1,763,550 doses of COVID-19 vaccines, out of which 1,565,850 are AstraZeneca, sourced from various platforms that donated towards Ghana's fight against the virus. The remaining are the 20,000 Sputnik V vaccines purchased from Sheikh Al Maktoum and the 177,000 Johnson & Johnson vaccines from the African Union, both of which were paid for by the government of Ghana. The Ghana Health Service reports that of the over 1.2 million doses administered, 865,422 persons have received one dose, while 405,971 of the number have taken their first and second doses. But the idea of inoculating the Ghanaian populace was first mentioned in the 21st update on the virus by President Akufo-Addo. By the 23rd update, the government had planned to vaccinate 20 million Ghanaians.
Our aim is to vaccinate the entire population with an initial target of 20 million people. Through bilateral and multilateral means, we're hopeful that by the end of June, a total of 17,600,000 vaccine doses would have been procured for the Ghanaian people.
Ghana received 600,000 doses of AstraZeneca through the COVAX facility on February 24 this year and was the first country to have benefited from the platform.
So from Tuesday, 2nd March, to Monday, 15th March, 2021, the Ghana Health Service will begin deployment of the 600,000 AstraZeneca vaccines, with person in groups 1 and 2 being the target of this first vaccination campaign.
The actual vaccination began on March 1, with the president, his vice and their spouses taking turns to take the jab at a well-publicized event. The aura and media coverage the event received was a reflection on how important the gesture was to the success of the vaccination, as some Ghanaians had vowed not to partake in the exercise unless the president does so publicly.
Papa. Meeting radio so. And I pay Nana Kofi you know, and check no be so kind to us said running on GB. It's me so mendi.
Papa no waje FDS work and no magic.
On one day, actually,
why don't they test them right over there before bringing this thing over here? We're not acceptable. We're not going to accept. Me, I'll never accept. I don't know other people. Okay. I'll never take it.
Oh no, but the other places.
And some people were saying when they inject you with the kind of that thing, you have human, have robot. I don't know which is which. But I've taken the 6s or whatever it is. We don't know.
The first phase of the vaccination was on 2 levels, which involved high-risk persons in the Ashanti, Central and Greater Accra regions, and the vaccination of health officials in all parts of the country. It took place from March to the middle of April. While this was ongoing, the government was on a quiet taking delivery of more vaccines. Within this period, Ghana took stock of 4 different consignments, all being AstraZeneca. On March 5, 4 days after the vaccination began, the government of India donated 50,000 doses to Ghana. On 11th March 2021, the government of Ghana provided 2,000 vaccines to be used to inoculate some government officials on special assignments outside the country. MTN Africa, through 2 interrelated platforms created by the African Union, provided Ghana with 165,000 and 149,850 vaccines on March 22nd and March 30, respectively. The cumulative numbers of these 5 consignments, totaling 966,850, were largely administered as first doses for the 865,422 persons. This was followed by the arrival of 350,000 AstraZeneca vaccines to kickstart the administration of second doses, which took place from May 19 to the mid of June.
In the past few days, government has, through COVAX, received an additional 350,000 doses of AstraZeneca vaccines. These will be added to existing stock to provide the second jab for the 360,000 persons in the 43 districts in the Greater Accra, Ashanti, and Central regions who received their first jabs from 1st to 9th March.
Though government efforts were commended by stakeholders in the health sector, the figures are nowhere close to the number needed to either attain herd immunity or meet the target of providing 17.6 million vaccines by the end of June, as the president stated in his 23rd address, a point the president acknowledged in one of his addresses.
International vaccine politics and the unpredictability of the supply chain, as well as the third wave of infections in some countries in Europe and Asia, have meant that we have not been able to secure as many vaccines and vaccinated as many Ghanaians as we would have wanted at this stage.
But a public health analyst who has been observing Ghana's vaccination drive believes this was avoidable.
I think if we had been more open to clinical trials, that's something that could have given us a bargaining chip. And I'm glad that eventually now we are currently running the Sputnik Light trial. And those are things that maybe we could have considered doing earlier. Obviously, the challenge was that there was a lot of misinformation, but I worry that, sometimes that the response to that overshadowed the reality that was not a bad idea to host the clinical trials here. That's something that we have to get more comfortable with and be more open to doing going forward.
The government, after getting indications of difficulty in procuring vaccines through bilateral and multilateral means, engaged the services of some middlemen. One of them, Sheikh Al Maktoum, whose services became a matter of an ad hoc committee probed by the Parliament of Ghana, provided the country with 20,000 Sputnik V vaccines at interval levels, with the first being on March 3.
And people were dying. February 78, March 56, these were the numbers. And if you, any of us here, were the health minister at the time, I think you might have taken certain decisions that on hindsight, you may not have done those things. This was the environment that I found myself in. Out of desperation, frustration, so many things. And people were dying, we needed to protect our citizens.
This batch of vaccines was administered to persons who were involved in the population and housing census. Though there were clear challenges in the quest to acquire vaccines, the government and health officers had expressed confidence in getting more vaccines in the third and fourth quarters of 2021 despite challenges. It is therefore not surprising the government on July 24 and August 17 received 177,000 Johnson & Johnson vaccines and 249,000 AstraZeneca vaccines from the African Union and United Kingdom respectively. This has revitalized the vaccination drive, and centers have witnessed an impressive rush for the jabs. At the end of the administration of the Johnson & Johnson doses, some vaccinees complained about the shortage of the vaccines. The AstraZeneca doses, which are yet to be deployed, will be used to clear the backlog of persons yet to take their second doses.
That we are getting approximately 600,000 doses is part of the consignment that is coming, the 600,000. As for that backlog, it will be cleared. Because the first is 250,000, we'll get another 250,000. Clear the backlog.
But all this seems to be a drop in the ocean compared to the goal of vaccinating 20 million of the adult population. A dashboard prepared by a public health analyst, Nana Kofi Quakyi, reveals that government has so far fully inoculated less than 2% of the population. Government communications over the period has, however, outlined clear sources of vaccines to meet the target.
We had 177,000 doses of Johnson & Johnson, which is one dose, out of the 17 million Johnson & Johnson that we have already committed ourselves to get from the African Vaccine Acquisition Tax Team. We are expecting also very soon, maybe before the end of the month or early September, another 249,600 AstraZeneca, which is also coming from Europe. And we are also expecting Pfizer. As you are aware, we have improved our cold chain system. So we can store and deploy ultra cold chain vaccines. So we are expecting 1,229,670 Pfizer for the first time in this country. And we are also expecting Moderna recent, which we also got to know about it only last week.
The government has however been criticized for not being realistic.
So if you look at Ghana Health Services' own projected timelines, you look at the J&J being our dominant vaccine in that respect, and you look at the J&J production timelines, where, I mean, across the whole continent for the rest of the year, they're going to produce 30 million doses. There is no way Ghana is going to get its full share of 17 million in 2020. That's just not going to happen. So the reality is that the 2020 target of 20 million, just looking at the timelines from manufacturers, from donors, from distributors, it does not support that that's feasible. So we're probably going to be looking at getting to 20 million, maybe even mid to late 2022.
Pushed on whether it will be feasible to administer these vaccines within 4 months, even if government takes stock of the vaccines, Nana Kofi Quakyi answered in the negative.
If you look around the African continent, who is vaccinating at some of the highest rates on the continent, you're talking about countries like South Africa, countries like Morocco, who are vaccinating, sometimes close to 100,000 a day. On good days, they're hitting 200. Even if we're hitting those levels, it would still be quite a stretch, because we also have a more limited healthcare delivery system than they do.
But the service, however, says it has enough experience and expertise in vaccine deployment to worry about the ability to carry it through.
But we've had experience we've vaccinated 42% of the population before. These were under 15. And we did that in 7, maximum 10 days. Normally we add some 2 days as mop-up. And so it was based on our experience that we are only limited by the vaccines. Otherwise, if the people are willing to go for the vaccine, we can do this in 2 weeks.
While the debate on whether government is capable of inoculating 20 million Ghanaians by the end of 2021 continues, the government says it is putting in place measures to produce vaccines locally. A committee chaired by Professor Frimpong Boateng is in charge of this particular matter. Reporting for Citi News, Hanson Agyemang.